Today I'm sharing the story of a man who lived with chronic pain for more than 25 years. And for 20 years he underwent heavy medical treatment, including up to 400 milligrams of tramadol per day. Despite that, there was no lasting improvement. By the age of 70, the situation seemed completely entrenched, and yet the problem was neither his age nor a lack of effort. The real issue was that the focus remained on managing symptoms without ever understanding what had been sustaining them for years. In this video, you will see what becomes possible when the entire framework changes. This is Gérard's story.
Anyway, I wanted to say thank you actually for offering to give this testimony.
To me, it seems completely natural and normal because you share your knowledge with us, obviously, and whether it's your advice, the relationships I have with colleagues, well, let's say members of the community, I've been able to eradicate. I do mean eradicate. Fibromyalgia at the present time.
I was wondering, could you tell me exactly how long you had been experiencing those symptoms for?
How long had I been having the symptoms? Yeah. Well, I'm 77 and a half years old. And the symptoms, I've had them for 25 years.
For 25 years of fibromyalgia. What did you actually put in place then? What did you do for 25 years to try and manage it well exactly to deal with your fibromyalgia?
I drifted. I slowly drifted with medical treatments. Standard conventional medicine. Yeah. It was originally identified by a rehabilitative psychiatrist who referred to the condition at that time as SPID. And then I started to take and swallow what was recommended to me. That is to say, the standard prescribed medications for pain. It was only a few weeks later, or let's say about 3 months later, when I realized that my condition wasn't getting any better at all. They eventually told me, we're going to move on to the next phase. This means that we are going to start giving you tramadol, which is essentially a milder form of morphine medication, but it is still morphine nonetheless. However, never once did a medical doctor ever tell me that it would bother me, trouble me, and eventually make me completely dependent on the medication. Besides all that, over the course of 25 years, I have now reached a 60% reduction in my dosage. Okay. It's really hard. It's always difficult, but I'm not giving up.
And when you started the program, what dose were you on?
When I started the program, I must have been I had lowered it a little bit, but not much. I was at 375.
Oh yes, okay, so quite a bit.
It's not much. And now, I am finally below 200 pounds. And it is all thanks exactly to the incredible Ipigenize method. I have to say that I'm not just being flattering. I'm saying it honestly, frankly. Oh, yeah.
And when did you start the program?
In July 2024, that is to say, it will be 1 year. There you go. 1 year.
Almost a year, yeah, okay. And from when did you start to see that your body was starting to get better?
After 2 months.
2 months, that's about it. 2 to 3 months normally. Okay. In what way? What have you seen improve, for example?
The pain, mostly. That vague and diffuse pain, which shifts and moves around the body, especially noticeable in the back.
And you, regarding your digestive system, how was it before?
The digestive system was functioning reasonably well. I used to take medication for constipation. But these days I have a healthy bowel movement at least once or twice a day.
And how is your skin?
My skin, it looks really great. I think it looks good. And I'm feeling quite handsome.
But did you see a change with the program specifically?
Yes, because I sweat a lot more.
Yeah, that's pretty good.
I sweat a lot more, and so I eliminate much more.
All right then. And today, how would you describe your pain level? Is there still a trace left, or where exactly do you stand with the pain right now?
Let's say just a tiny bit. My sleep has improved. I have almost no pain, except for one pain whose origin I know from the X-ray, which is that I had a bike accident. I wanted to go cycling again with my grandchildren.
And during the day, then, your vitality, how are you in terms of energy?
Vitality itself has successfully regained its momentum, speed, and intensity.
Oh, well done. That's good. And those around you, do they see the difference?
Yes, those around me see the difference. My wife tells me every day.
Oh, yeah? Okay.
Oh, that is absolutely true, because before I had the chance to meet you, I was feeling completely prostrate and utterly overwhelmed, almost. I was finding myself entirely unable to provide her with any help at all. Now I do as much work as she does.
And when you joined the program, did you have support?
My wife in particular, and my son. If you have someone who can support you through it, I think I'm not saying it's an essential condition, because not everyone can have that luck, but it's incredibly important nonetheless.
Gerard, you've come a long way. You started from far back, 25 years of suffering.
Oh yes, I was in a very, very bad way indeed when I signed up for A Pigeon Eyes. I really was in a very, very bad way.
Huge congratulations to you, and you've been very consistent. You have done a fantastic job. Really, the body responded incredibly well.